Iodine is really important. It's an essential element for synthesis of thyroid hormones such as T3, T4, which plays a really important role in the development, growth of metabolism of every organ in our body. The National Institute of Health, 2016, recommends a daily consumption according to age, starting from 90 microgram for children from the ages of 1 to 8.
And for adults, that would be 150 microgram per day.
Iodine is found in high amounts in seafood, dairy products, grain, eggs, and poultry. Iodine levels can be measured through a 24-hour urine collection, which is referred to in research as the golden standard in measuring iodine levels. A single blood test is also a possibility, or the iodine patch test. And for any of you that do not know what iodine patch test is, basically when you take iodine, it has a yellowish color, and you put it into, you mark a circle on the patient inner arm, and you let it dry. And you want to look at it in the next 3 days. And if the yellowish patch fades, absorbed into the skin, less than 24 hours, it might indicate deficiency. Now, obviously, this is not this is not a lab test, and it might be used as a screening tool, but I've used it many times, and my team have used it with patients. And we did find a correlation between the patients that eventually found out that they require iodine, because the iodine patch test showed that within less than a day, that was mostly disappeared. But it's a very cheap test to do. You just buy iodine with a roll, and Standard Process are selling those. They're like $5 or $10. And then data from the National Health and Nutrition Examination Survey showed that pregnant women in their first or second trimesters had median urinary iodine concentration that were less than adequate. 57 lactating healthy mothers in Boston area reported a study that looked at the levels of iodine, reported that close to half of them, 47% of women sampled, may have been providing breast milk to their infants with insufficient iodine to meet infants' requirement. And then again, a study with 115 vegans, 55 vegetarians, and 35 pescatarians from Oslo region of Norway between the ages of 18 to 60 showed that the median urinary iodine concentration in vegans was 43 microgram per liter, which is indicative of moderate iodine deficiency. In vegetarian and pescatarian, it was just mild. So if you're seeing patients that are pregnant, it might be worthwhile to have a conversation, make sure that they have enough iodine. And then if you have patients that are vegan or vegetarian or pescatarian, then also making sure that they're educated about having sufficient amount of iodine. And then about 50% of the participants in this study, they're not aware of their deficiency. About 50% of them had lower intake levels than what is required, which is 100 microgram per day iodine intake. And then restriction of iodine, less than 100 microgram per day in patients with hypothyroidism as a result of Hashimoto thyroiditis showed signs of recovery in 78% of the group. So this is really interesting, because this is where we already dive into if they consume, we talked about if they consume too little iodines, but what if they consume too much iodine, right? And so in this particular study, they restricted them to just a little bit less than 100 microgram of iodine per day, and they saw signs of recovery in 78% of the group. Then another study reported that iodine restriction led to normalization of serum thyroid stimulating hormone concentrations in patients with negative anti-thyroid antibodies. However, TSH level remained elevated in those with positive antibodies. So again, if we have positive antibodies, then this is what we refer to as an autoimmune condition, and we have to look at the underlying causes of that subclinical systemic inflammation, right? This would not be an iodine deficiency or iodine excess. This is most likely going to be a subclinical systemic inflammation.